Hi everyone, I'm Dr. Justin Lin here at Rehab Revive Physical Therapy, where we rehab your mind to revive your body. Today I want to do another segment about those of you who are suffering from sciatic nerve pain, back pain that's just not getting better. You've tried the prone press-ups or the McKenzie exercises that are trying to get into extension, and it's still not working. You're still a little bent over, rotated. You might have found yourself as very difficult to straighten yourself. You're locked up in the back. Sometimes you have a lateral shift, and that's what we got to work on, this lateral shift. And we got a great exercise. It's a progression, and or if nothing else is working, you want to try this. So let's get to it. So let's give a little background. This exercise is mostly appropriate when you have the sciatic nerve flaring up, you're kind of bent to the side, and people do walk in like this and they're like, oh, Dr. Lin, I need help. And sometimes people actually go to the chiropractor like this and it gets worse. So you want to avoid getting manipulations and you want to do subtle exercises. So it's what's going on here is the actual spine, if this is my lower back, they're stacked up like this, but one of them has shifted out to the side. You get nerves that are angry, you get your disc that's angry, your spinal cord's angry, you're weak, you can't straighten up. Most of the time you're just laying in bed and life sucks. Life sucks like really, really bad. And so you can try the nerve flossing, you can try prone press up, but that's probably also painful too. And there's a great exercise that's been taught all across the board. A lot of people do it too quickly, a lot of people do it too hastily, and they can get injured. So check with your healthcare professional, make sure this is the right exercise, but I want to teach you guys how to do it safely, and that's the key. So do this safely, and we'll get right back to it. All right, we're going to talk about this exercise. So some of you have woke up with a lateral shear like this, and what you're going to find out is that you're already kinked that way, so I would flip that around. So let's just say I'm kinked this way, and what I'm going to want to do is I'm going to push using the webbing of my hands to start applying some pressure, but mostly it's my legs doing it. So I want you guys to know a lot of people are actually forcing with their arms, and that's not good because that's not a pure axis. This just stabilizes the actual lumbar spine. So let's say it's over here, I'm just stabilizing it and my body is doing the rocking to pull this back into place. So how you want to be about elbows length away from the wall. You're going to use the wall. And so let's just say I'm like over here. Now my goal is to start at the lower base of my ribs, and I'm just going to just shift in. Once I feel, you basically can keep going as far as you feel it before there's tension, pressure, or pain, or symptoms. But if that's okay and you feel like you're at your limit, you can go down 1 centimeter at a time and keep pressing that. So it's a little tighter here on L2, L3. L4 is slightly right where kind of like your pelvic girdle is. And then L5, where my mic is right here, that's L5, S1. So a little twingy here, but not too bad. Usually I have a culprit because my disc problem is on the other side. So it's going to be, let's check here, lower rib here, that's about L1, L2, it's starting to get a little stiffer, so I'm gonna go pressure on, pressure off, pressure on, pressure off, pressure on, pressure off, and it's starting to free up a little bit more than initially. So pressure on. Let me go down another segment here. Like I said, I'm not forcing myself too much. I'm just using my legs to kind of come back and forth and really holding on to this, giving it a stability at that segment. So now that's getting a little bit better. I'll go down to that crest, that pelvic crest, that's L4 area. And that's starting to get a little achy for me here. So we wanna just be cautious, and I'm starting to get a little symptoms like right through here. So not unusual for me, but you know, it is, I don't wanna get myself like side sleeping, for instance. So let's go down to L5, S1, and that's the big restriction. Here's the difference. You can see if I'm on this segment, boom, really good. On this other side, I can only go this far, it's very stiff. So some of my golfers, my baseball players, some of these lateral sports, rotationary sports, we need to work on this. So I'm gonna go try, yeah, now it's starting to open up a little bit more at this segment, and I can get a little bit further, which is great. So that just opened up, and I'm pretty much just done with this exercise after that, and I'll do this several times. So yeah, you can see that quickly. We can do a little before and after. Initially I started one way, and then after I can do the other, but I have a lot more mobile hips now, ready to do my salsa. All right, we're back. As you can see, I had one side that was a little limited. Fortunately, I don't have a lateral shear or a lateral shift in my spine, but doesn't mean it can't happen. This is actually prophylactic for me to work on these, and I could feel a little bit of stress strain, but we want to get this mobility good. And so this is an important exercise to just make sure you're doing it safely, make sure you got the right setup, make sure you got the right force. You don't really want to push too hard, and I think people will get too aggressive, especially as they start feeling that pain and they want to scratch that itch. So just be careful. This is a great exercise, but do this after you've tried the other ones like prone press up or these McKenzie type exercises, and it's just not working. So give that a shot. We'll link those exercises so you can check that out first before you do this. And so you want to make sure you've been evaluated before you do this, because you could hurt yourself more. But yeah, I'm excited to give this to you guys and educate everyone properly. If you want to keep learning more here at our channel at Rehab Revive, please subscribe below, leave your likes, leave any comments, let us know if this exercise helped you and has benefited you, and if you share it, please share it with others as well. I'm Dr. Lin. Remember, we heal smarter, not harder.